How can we shift from a reactive to a proactive culture of care? Your organization says it cares. You have wellness initiatives. Your policies technically cover life events and personal leave. You even tell your employees, let us know how we can support you. But here's maybe what actually happens. Somebody burns out. Someone quits suddenly. Someone disappears from the promotion pipeline. Then leadership scrambles, and the conversation about care begins. This isn't a strategy, it is crisis management. And the longer we wait for people to raise their hand, the more we miss the opportunity to build something stronger. So today we're unpacking what a proactive culture of care really looks like and how to get there. If we haven't met, I'm Dr. Anna Thomas. I'm a physician, leadership speaker, caregiver advocate, and corporate wellness specialist. I help organizations strengthen their workforce and create workplaces where people and performance can thrive together. Even as we enter an era of AI, automation, and agentic teams, the future of work is still human, and that work is changing dramatically. But at the same time, employees are navigating complex personal and professional pressures that are only going to escalate in the coming years. For example, in the next 5, 10, 15 years, we will see an exponential increase in the number of older adults who will need caregiving support. Who will be providing that care? Working adults. Right now, 63 million Americans are caregivers. That's 1 in 4 adults, with more than half of them currently working full-time. Those numbers are expected to increase and will have a tremendous impact on our communities and, yes, even our workplaces. And caregiving is just one example of a personal stressor that will impact the workplace. Mental health, chronic illness, stress, and burnout are all on the rise, and the organizations that will thrive are those that lead with care, culture, awareness, resources, and empowerment. Care. Through this series, I share practical strategies, leadership tools, and insights to help you create cultures that support well-being, strengthen engagement, and retain top talent. If you'd like a clear starting point, then check out my free training, The Future of Work is Care. The link is below. And while you're there, be sure to like, subscribe, and share this with another leader who is ready to build a workplace that cares. Let's get into today's topic. I've spent years watching what happens when workplaces treat well-being or personal pressures like exceptions. In medicine, we say preventative care saves lives, but most workplaces still operate like emergency rooms. They wait until something breaks, then they try to fix it. And the same thing happens with burnout, caregiving, or mental strain. We don't talk about it until someone's in crisis, until someone asks for leave, until someone quietly stops showing up as their best self, and no one knows why. This reactive approach costs us more in morale, in turnover, in trust, in leadership credibility. So in this video, we'll cover why reacting isn't enough, what proactive support really means, and the 3 levers every organization can pull. How do you build a culture where people don't have to burn out to get help? So first of all, what does reactive care look like? You offer flexibility, but only if someone requests it. You say, we're here if you need us, but no one's sure what that really means. You have policies, but managers don't bring them up unless asked. This puts all the responsibility on the employee to recognize their limits, their judgment, hope their leader will respond with understanding. It places the burden on the very people who are already stretched thin, and the result? Silence. And silence always leads to burnout. Employees aren't quiet because they're fine. They're quiet because they've learned it's safer that way. They think, if I speak up, I'll be seen as less committed. If I ask for help, I'll fall off the radar. If I disclose what's happening, I might lose out on opportunities. By the time they finally raise their hand, they're already burned out, they're already disengaged, and they probably already have a plan to leave. So what does proactive care look like? A proactive care culture removes the need for secrecy. It says we expect that people will need support, and we've built for it. That's the shift. See, proactive doesn't mean over-accommodating. It means embedding care into how the organization operates before someone has to fight for it. And here's what that looks like. Well-being and flexibility mentioned in onboarding, benefits conversations, and ongoing conversations. Managers are trained to spot early signs of overload. You have surveys that include questions about caregiving or stress or capacity. You have performance cultures that value sustainability, not just speed. You have policies designed to flex with real life, not just emergencies. This is how you create psychological safety, not through slogans, but through systems that you actually implement. Here are the 3 levers to build a proactive culture. First, normalize the conversation. Start talking about care before it's urgent. Mention in all hands meeting, wellness weeks, engagement surveys. Encourage your leaders to name it openly, even briefly. When you normalize the language, you remove the stigma. Second, you have to build your manager muscles. Managers are your first responders, but most haven't been trained to talk about life challenges effectively. You want to equip them to ask without prying, to offer support without overpromising, and to hold performance expectations with flexibility. Know when to escalate. Investing in manager skill building is one of the most scalable strategies you have. Third, designed for prevention, not crisis. This is where policy and culture meet. Don't just have a mental health or leave policy. Make it easy to access. Don't just say we're flexible. Define what flexibility looks like. Don't wait for a breaking point. Check in regularly for early warning signs. Think of it as your workplace immune system, proactive support that keeps the entire system stronger. Let's talk about some examples of proactive care in action. It could be a team that discusses workload and well-being in their quarterly check-ins, not just during the semi-annual performance review. It could be a company that tracks burnout or care-related attrition trends and responds with real adjustments. It could be a manager who says, what would make it easier for you to stay engaged and growing this quarter? This isn't about hand-holding. It's about smart, caring leadership. When people feel safe to be honest without penalty, they stay, they perform, they innovate, they bring their full capacity to work. And that only happens when the system supports them before they fall. If you're ready to move from reactive to proactive, then start with my free training, The Future of Work is Care. It is a roadmap for building resilient, human-centered systems that strengthen retention, engagement, and well-being. The link is in the description below. And if you haven't yet, be sure to check out my book, Workplaces That Care. It is your playbook for building a culture where people and performance can thrive side by side. Now, if you're watching this, you're probably one of those people trying to shift things from the inside. And I know that's not easy. You're pushing against systems designed for a world that pretend that life and work are separate. And it's not. But here's what I want you to remember. Every time you normalize care, every time you train a leader differently, every time you prevent burnout instead of reacting to it, you're not just changing leadership, you're not just changing HR, you're changing lives. So keep building. In the next video, we're going to talk about how do I even know how many employees on my team are facing these personal pressures. We'll talk about what to ask, how to listen, how to uncover what's really going on without forcing disclosure. And while you're waiting, you can watch Is Care Really an HR Concern? Because proactive care starts by knowing where life pressures live in your organizational chart and your culture. Remember, even in the age of AI, the future of work is still human. So let's create workplaces that care.